Hello, everyone. Thank you for watching this paper by Lucía López and Nadia Arias from the Universidad de Salamanca, titled Defining Challenges in EMP Instruction in Spanish Higher Education. In the contemporary landscape of medicine, English has become the global language of communication. Whether in a specific publishing, academic instruction, international conferences, or clinical practice, English dominates nearly every facet of professional medical discourse. This dominance is not merely a reflection of linguistic preference, but the result of historical, political, and economic forces that have shaped the medical field over the last century. Undoubtedly, English has become the international language for medicine, a transformation that has occurred with surprising speed and scope over just a few decades. This shift has enormous implications for medical education systems worldwide. In countries where English is not a primary language, the need to integrate English for medical purposes, or EMP, into medical curricula has become increasingly urgent. Fernando Navarro, arguably one of the most prominent medical translators in Spain, traces this evolution by highlighting the dramatic increase in English language references within Spanish medical literature, from just 3% in 1920 to 80% by 1995. Similar patterns are observed in countries like France and Germany, where the proportion of bibliographic references in English now surpasses those in the national languages. This demonstrates not only the internationalization of medical science, but also the critical need for English proficiency among future healthcare professionals. Yet, while English enables access to new research and facilitates collaboration, it also introduces new challenges for both learners and educators. EMP is not simply about language instruction, it is about preparing students for a specialized professional domain, which includes understanding and producing academic texts, participating in professional clinical interactions, and navigating doctor patient communication, all in a second language. These communicative demands go far beyond general English proficiency, requiring targeted instruction and context specific teaching. Thus, the importance of EMP cannot be overstated. It is a gateway to academic and professional participation in a field where English is no longer optional but essential. And yet, teaching it in the Spanish university context is far from straightforward. In the following sections, this presentation explores the specific challenges encountered in EMP's instruction, the insights gained from student feedback, the ambiguity surrounding course objectives, and the potential pathways forward. Through this, we aim to offer a critical and practical reflection on how we can better align EMP teaching with the real world needs and expectations of future Spanish speaking healthcare professionals. Despite its relevance, English for medical purposes occupies an ambiguous place in Spanish higher education. On paper, EMP is recognized as a necessary part of training for future healthcare professionals, whereas in practice, EMP often lacks institutional support. Courses are under resourced, inconsistently delivered, and perceived by students as marginal to their core studies. One of the key issues is the disconnect between the importance of English in international medical contexts and its lack of visibility in national assessment systems. English is not tested in Spain's mere licensing exam, which leads to many students to deprioritize it in favor of more immediate subjects like anatomy or pathology. This perception of English as a non essential add on is further reinforced by its association with the humanities, which are often viewed as less rigorous or relevant within the structure of medical education. As a result, EMP is frequently seen as an external, even optional component of training rather than an integrated practical skill set. This situation is further complicated by the structural conditions in which EMP is taught. At the University of Salamanca, for instance, EMP is offered as a mandatory course during the third or fourth year of study, It is the only formal English instruction most students receive across their 6 year degree, and many of them have had little or no practice in English since secondary school, and proficiency levels vary widely. Although courses are designed with a baseline B1 level in mind, real student ability often spans a much broader range from basic to near fluent. Teaching English in contexts characterized by large and highly heterogeneous groups presents considerable challenges. In such settings, disparities in language proficiency among students often result in uneven classroom participation, limited engagement, and unequal learning outcomes, which ultimately lead to a fragmented learning environment. In classes where students present a broad range of linguistic abilities, instructors are often forced to teach to the middle level, inadvertently neglecting both lower and higher proficiency students, thus leading to the disengagement of less advanced learners who tend to feel overwhelmed and more proficient students who often feel unchallenged. When these issues are situated within the context of English for medical purposes, where language instruction must be aligned with highly specialized and professional content, these challenges intensify. Medical English instruction requires the integration of professional discourse, academic writing, and clinical communication, and must respond to broader societal changes, which bring forward the need to enhance students' intercultural awareness, a shift that demands innovative pedagogies, but also institutional actions such as reduced ratios, investments in technology, or teacher training. Furthermore, medical students not only differ in their general English proficiency, but also in their familiarity with medical terminology, their academic backgrounds, and their expectations of the course, all factors that make the design of a uniform curriculum particularly difficult. Direct student feedback provides crucial insight into how EMP instruction is experienced on the ground. Drawing on evaluations and informal discussions with third and fourth year medical students at the University of Salamanca, where the EMP course is compulsory and represents their only formal English instruction, several recurring themes emerge. The most prominent concern is relevance. While students generally acknowledge the importance of English in the long term, particularly for reading research, pursuing international opportunities, or working abroad, they often struggle to see the immediate value of the course. Since English is not part of the mere licensing exam and the course carries relatively few credits, many students feel it adds pressure without offering tangible academic benefits. In their view, EMP is secondary to the clinical and biomedical subjects that dominate their curriculum. This disconnect is further reinforced when course content does not clearly align with students' current academic tasks or anticipated professional needs. Activities that focus on general grammar or everyday communication are often viewed as too basic or disconnected from real world medical use. Instead, students express a strong preference for targeted practical tasks, such as interpreting clinical texts, preparing academic presentations, or practicing patient communication. There is also a desire for more focus on scenarios based on real clinical situations. Several students have also pointed out that the course feels rushed and superficial due to time constraints. They would like more depth, particularly in areas that feel directly useful. Overall, the feedback reflects a clear preference for an EMP course that is practical, specific, and clearly tied to both current studies and future medical practice. One of the most persistent challenges in designing and delivering effective EMP instruction in Spanish medical schools lies in defining its scope. A single semester long course is often expected to address a wide range of needs, typically falling into three overlapping categories. First, academic English for scientific communication. Second, clinical communication skills for doctor patient interaction. And third, general English language improvement. Trying to cover all three in limited time inevitably leads to compromises that affect both teaching and learning outcomes. The demand for academic English is particularly strong, as noted by Navarro, but at the same time, clinical communication in English is becoming more relevant. With the increasing mobility of patients and healthcare professionals across Europe and the growing multicultural nature of Spanish society itself, doctors are more likely than ever to encounter patients or colleagues who don't speak Spanish. EMP courses must therefore prepare students to manage consultations in English, asking questions, explaining diagnosis or procedures, and showing empathy in unfamiliar cultural and linguistic contexts. These skills differ from academic ones. They rely more on international strategies, simplified language, and the ability to adapt quickly. Layered onto these two specific areas is the reality that many students still need to reinforce their general English foundations. Although courses are often designed for students at B1 level or above, there is considerable variation in actual ability, with some students still struggling with basic grammar and vocabulary, while others are far more advanced. Instructors then face the dilemma of how much time to allocate to general language support without losing focus on the specialized aims of EMP. What is needed is a more strategic approach, possibly through modular or level specific instruction and clear guidance on which objectives should be prioritized at each stage of the medical degree. Only then can EMP become a more coherent and effective part of professional training. However, addressing the challenges of EMP instruction in Spanish medical education requires both classroom level strategies and broader institutional support. While the structural limitations are real, there are still practical ways to improve the student experience and learning outcomes. At the course design level, conducting a basic needs analysis at the beginning of the semester is essential. Technology can help bridge some of the gaps, and scaffolding is also crucial. Working with authentic materials such as medical articles, clinical guidelines, and conference videos helps students to see the relevance of what they are learning, but these materials must be made accessible through pre teaching vocabulary, guiding questions, breaking longer texts into sections, or offering model answers. Pairing authentic input with supportive structures allows all students to benefit regardless of their starting level. Task based language teaching also offers a strong pedagogical framework for EMP, with real world tasks such as preparing case presentations, summaries of research articles, or simulating clinical interviews, making language learning more meaningful. They help students develop the skills they actually need while keeping motivation high. However, classroom strategies alone are not enough. For long term improvement, institutional support is vital. Medical and language departments should work together to integrate EMP more fully into the curriculum. Ideally, English instruction would span more than one semester with modules tailored to different skill areas. Smaller group sizes, dedicated resources, and professional development opportunities for instructors would also help ensure quality and consistency. In conclusion, while English for medical purposes is often viewed as a peripheral requirement, it holds much greater potential than is currently realized in most Spanish medical programs. When designed with purpose and delivered effectively, EMP can do far more than teach language. It can support the development of core professional skills that are vital in 21st century healthcare. Beyond grammar and vocabulary, EMP tasks encourage critical reading of research, clear communication of complex information, and effective interaction with diverse patients and colleagues. For instance, practicing doctor patient communication in English allows students not only to build fluency, but also to develop empathy, cultural sensitivity, and the ability to explain concepts clearly and compassionately. Similarly, activities like academic presentations, collaborative writing, or structured debates on ethical issues deepen students' ability to reason, persuade, and synthesize knowledge across different formats and audiences. These are essential skills for any medical professional, whether working locally or internationally. By reframing EMP as a tool for professional development rather than as a remedial or supplementary subject, its value can become more apparent to both students and institutions. To reach this point, however, systemic changes are required. EMP must be embedded more meaningfully in the curriculum, supported with appropriate resources, and taught by instructors with specialized training. If this is achieved, EMP can become a powerful space for preparing students not only to succeed in English, but to thrive as communicators, collaborators, and compassionate healthcare providers in a globalized world. Thank you very much for your attention, and we will be glad to answer any comments or questions in the forum. Thanks.